So it is 7:01. Thank you for joining us for the Get the Facts on the Vax, straight talk from Cleveland Clinic doctors. This is a panel all about the COVID-19 vaccine, co-hosted by NAMI Greater Cleveland and the Cleveland Clinic. We are here tonight to talk to you about the safety and development of the COVID-19 vaccine and answer some of the questions you may have about the vaccine. My name is Matt Gasecki, and I am the Community Outreach and Education Coordinator for NAMI Greater Cleveland, and I am pleased to be the moderator and host for today's presentation. Before we get started on the subject at hand, I would like to speak just very briefly about NAMI Greater Cleveland and our programs and services. If you are not familiar, NAMI Greater Cleveland is the local affiliate serving Cuyahoga County of the National Alliance on Mental Illness. We are engaged in work that supports the quality of life for family members and individuals living with mental illness. And we do that work by focusing on education, support, information and referral, and advocacy. We offer support groups for individuals with mental illness and their families. We offer courses on the topic of mental illness and living with mental illness well. We offer a helpline from Monday through Friday, 9 a.m. to 5 p.m. that is staffed by trained employees and volunteers who are ready and available to assist anyone in the community that is seeking referral to mental health resources, navigating the process, learning more about what's available in the community in terms of resources beyond mental health. And NAMI also supports advocacy in the sense of raising awareness about mental health conditions, reducing the stigma around mental illness, and supporting national and local legislative efforts to support greater access to mental health services and more humane mental health treatment options. So that is a little bit about NAMI Greater Cleveland for those of you that are not familiar. We are pleased to be in partnership with the Cleveland Clinic for this program. Our guest panelists today include Dr. Goji and Dr. Zayas. I would like to offer both of them the opportunity to briefly introduce themselves. And after that, I will give you a little bit of a guide for how the next hour is going to unfold. So Dr. Goji and Dr. Zayas, whoever feels comfortable sharing first, just let us know a little bit about yourself.
Hello all, my name is Oluwatosin Goji, but you can call me Tosin. I'm an obstetrician gynecologist and also an infectious disease specialist. I have been involved with COVID vaccine campaign and writing guidelines about COVID prevention. And I'm happy to be here with you to discuss about COVID infection, COVID vaccine, and answer as many questions as we can. Thank you for having me.
Thank you for having me here. It's a pleasure and an honor to be with all of you tonight. I am Arnaldo Zayas, and I am a pediatrician at the Cleveland Clinic Children's Hospital. And I've been involved in campaigns as well related to education, particularly with the Hispanic community, to make sure that they also are educated regarding the safety and the effectiveness of the vaccines. Now is the time to take that step forward, and we want to make sure that we share that message to everyone in the community. So thank you so much for being here.
Thank you both for your introductions. So to start, I would just like to begin by thanking everyone for your collective efforts up to this point to make sure that you are and that we are doing everything possible to keep our communities safe. And I appreciate that all of you are on this webinar today to just taking the time to really inform yourself with helpful guidance straight from the experts when it comes to the COVID-19 vaccine. Many adults in the US still remain hesitant to get the COVID-19 vaccine, which is why we are sharing with you today. The physicians that are with us are going to talk about why the vaccine is our best hope for fighting the virus and ending the pandemic. We'll start today's forum with some introductory questions that are taken from questions that all of you supplied us with when you registered for this program. Then we will move into more of a listening portion, more of a Q&A. You can use the Q&A feature on this webinar to type any additional questions you may have, and they will be read and answered live. We will answer as many questions as time allows. This meeting is being recorded, and it will be available on the NAMI Greater Cleveland and Cleveland Clinic YouTube channels as well. So this question is open to Dr. Goji and Dr. Zayas. Can you speak a little bit about the safety and the development of the COVID-19 vaccine for our viewers?
Absolutely, I can start addressing that question, and thank you so much for that question, because that's pretty much the most important question. Are the vaccines safe? And that's something that I want to make sure that we have the opportunity to discuss in terms of the context under which these vaccines were approved. So during a pandemic, as you all know, this is a public health emergency. So this is a threat to the life of the people in the community. There's active spread, active transmission of the virus, patients coming to the emergency room, patients coming to the intensive care units. There's people dying. So there is a threat. When there is a threat, the Food and Drug Administration, or the FDA, needs to look into treatment options. But not only treatment options, also preventive measures that might not be approved, because we're dealing with this pandemic, with this particular issue, for the first time in our history. We've had other pandemics with other viruses, but with this particular virus, is the first time we're dealing with this. So we do not, at that time, at the beginning of the pandemic, we did not have available treatment options. We did not have available ways to prevent the virus in terms of a vaccine available. And that's what I want to make sure, that that's the context under which this emergency authorization use was provided for the vaccines. There is a threat to the community, and there something needs to be done to save lives. And with that context, then the clinical trials were undertaken. So that's something I want to make sure it's clear. There were no shortcuts at all in assessing the safety and effectiveness of this vaccine. No shortcuts. So clinical trials were performed. And what I mean by clinical trials is different participants, different patients received the vaccine. Initially on phase 1, it's a small number of patients. And we're looking very directly at the safety. Is there any worsening side effect, or is there any concerning side effect or adverse event that might indicate that this is not indicated to prevent this virus. So that's phase 1, looking at the safety. Phase 2, then we add more participants, more patients from different demographics, different medical conditions. Now we start looking at patients with underlying chronic conditions. And that gives us more information about the safety of the vaccine, but also a little bit about the effectiveness. Is it working? Are we able to prevent infection by COVID? Once we move to phase 3, then we look in detail, in greater detail, just because we have more number of patients, the effectiveness of this vaccine. And that's exactly what happened here. For example, with the Pfizer clinical trial, there were over 40,000 patients or participants from different demographics, and pretty consistent between all the different vaccines, the Pfizer, the Moderna, the Johnson and Johnson. Around 40% of the participants represented communities of color. So we're talking Hispanics, we're talking African Americans, we're talking Asians, we're talking Alaska Natives, American Indians. So we look at not only 40,000, but it was also a very diverse population as well. And that's exactly what happened. So phase one, phase two, phase three, looking at the safety, looking at the effectiveness. Once that data is available, and during a pandemic, we don't have the luxury of of looking at data for a year or 2 years or 3 years because people are dying. So we don't have the luxury to wait for data for 2 3 years. So in this case, we had data for those 2 3 4 months that those trials were happening, and the evidence was overwhelming about the effectiveness, over 95% effectiveness in terms of preventing a confirmed coronavirus infection, and particularly for the Pfizer and the Moderna vaccine. And also there was some evidence of decreasing if you indeed got COVID, there was decrease in the severity of the infection. So minimum hospitalizations and no deaths in those patients that received the vaccination. So once that data is available, that's when it is reviewed, and the FDA has very rigorous standards to review this data and then provide that approval. So that's the context in terms of approving this vaccine. No shortcuts were undertaken at all.
Thank you, Dr. Zayas. Before we continue, we are having a little bit of trouble hearing you. There's just it's a little soft, the audio on your end. I don't know if you can adjust maybe the microphone. Maybe you can test it just briefly to see if you can move it a little closer. But
Can you
yeah,
hear me okay?
yes, that's better. That's better. Thank you. Dr. Goji, did you want to answer any aspect of that question before we go to our next question?
So thank you so much. I agree with Dr. Zayas. He put it very well. And I just want to buttress the points he made. Apart from the FDA watching over the whole production, the two vaccines we have, the mRNA vaccines and the adenovirus vaccines, the mechanism is not new. You know, people think this is something new coming into the space of medicine. It's not new. So the Johnson & Johnson vaccine is made from what we call an adenovirus, which is the same virus that causes common cold. But the best way to describe it is they get the virus that causes the common cold, they shell it out so it can never replicate, and then they send it a message to go and produce antibodies for you. This mechanism has also been used for the Ebola virus vaccine. So it's not new. No one is using us as guinea pigs. For the mRNA vaccine, the mechanism is also not new. As we all know, we have loved ones that have cancer, and every year they're trying to find the best therapy with the least side effect for cancer. So 10, 15 years ago, the mRNA vaccine mechanism was already in production, trying to use it to take care of patients that have cancer to have minimal side effects. So it was not new. We're just fortunate that with the pandemic, smart people were able to take that technology and use it for this particular pandemic to save lives. The mRNA vaccine does not go into your DNA. It doesn't change your DNA. It doesn't change who you are. It's called a messenger because it tells your body how to make immunity to protect you. And once it sends that code, it disintegrates. So those are the things I want to start with. They are not new. They have been used on other platforms, and they're here to make sure that we don't get sick and increase our mortality. Thank you.
Thank you. Before I move to my next question, there is a very good question in our Q&A that maybe we can answer briefly, and that is, do you know when we can expect for children under 12 to be able to receive the vaccine?
So as of right now, it is approved for children 12 and older, and there are still we're still waiting to hear from the experts based on the trials and the new participants that enroll in different trials when that will be available. So as of right now, we don't have a timeline uh, for us to predict when that will happen.
Thank you. Here's another question. Why do I need the vaccine if I'm young and healthy and in good shape and I have a strong immune system?
Why do you need the vaccine? This is excellent. You're young, you're healthy. Thank goodness we're all young and healthy. But the COVID-19 infection is a novel infection. And as a novel infection, we learn more every day. Right now, we say we're young and we're healthy. But this virus, the SARS-CoV-2 virus, can mutate. And you might not be certain of what target it's going to go for in the body in the future. So yes, I'm happy that you're young and healthy, but with a pandemic and there is a novel virus and infection out there, you want to protect yourself against any possibility, any mutation. The other thing is what we call herd immunity, and I know Dr. Zayas will speak more about it. We get vaccinated to protect ourselves, to protect our family, our communities, our loved ones, so that we can all be safe. You might have somebody in your family whose immune system is not as great as yours. So getting that vaccine also protects them indirectly. Dr. Zayas?
Yeah, absolutely. And yes, can you hear me?
Yep, much better.
Yes. Yeah. No, I completely agree. I just want to add, in terms of, by you, even though you're healthy, by protecting yourself, absolutely right. You're protecting the ones around you, those that that have a weakened immune system, but also those children that, as of right now, less than 12, cannot get that vaccine. So you're also going to be protecting them against the virus. And we've been seeing also in the hospital, children with the coronavirus and an inflammatory response to the coronavirus. And we've seen them in the intensive care unit. We've seen them admitted to the hospital with high grade fevers and with a lot of inflammation. So this is the best way to protect the loved ones around you.
Thank you both. Next question. Can either of you speak about, there's sort of two topics in this same question. Can you speak about any of the current issues related to fertility in young women and myocarditis in young people that have been reported in relation to the COVID-19 vaccine?
So excellent, excellent question. This is a great forum. I will speak about fertility. So it's been proven over and over again that the COVID vaccines do not affect fertility. I know there was a story online about two researchers, and it's been debunked. They thought that there was a molecule, think about a bead, like a necklace I'm wearing. They thought there were four pieces of this bead that was similar to what is seen in the COVID vaccine and in the placenta. So their argument was if there's any similarity between the COVID vaccine molecule and the placenta molecule, there might be cross-reactivity and we might develop like an attack against the placenta. This has been debunked. Science has looked at it thoroughly. It's not true. That is number one. Number two, they're talking about the placenta, and I want to tell us that the placenta is only developed after you get pregnant. So even if you look at it that way to say it's going to prevent you from getting pregnant, that's not true. There's a recent study that looked at men before they got the COVID vaccine and after the COVID vaccine. They used the men themselves as a control. They looked at their semen, they analyzed their sperm count, motility and all. And in the same people, before and after the vaccine, there was no change in their sperm count. There was no change in motility and all that. So we know it's not true in this, I'll be small cohorts of men that were sampled in two recent studies. And for the women, the VSafe, which is the vaccine registry, is a voluntary thing whereby when you get vaccinated, you can put in your data. So nobody's coercing you, it's on your phone. So many pregnant patients have been putting their data, more than 35,000 by May. So many women got pregnant after getting the vaccine, and there is no increase in miscarriage compared to the general population in the country. The other thing is, in every study, as Dr. Zaya started, we have what we call animal studies. There were no safety signals in the animal studies to show otherwise. And that's why pregnant patients in tens of thousands have received the vaccine. So there is nothing to substantiate that concern. But it's good to talk about it so that we can get answers and clarification.
Thank you, Dr. Goji. Dr. Zayas, do you want to talk about the other part of this question, the myocarditis?
Absolutely. Can you hear me okay? Just want to make sure.
Yep. Yep.
Okay. Yeah, so in terms of myocarditis, so myocarditis is, I just want to first start by describing what myocarditis is, and pretty much it is an inflammation of the heart muscle, and typically we see that in children due to infections, and with their coronavirus vaccine, there has been a report of around a little bit over 1,000 cases of myocarditis. And what we mean by that is these patients might present with chest pain, with shortness of breath, and there could be some changes in the when we look at the conduction of the heart. There could be some changes there. There could be some evidence of inflammation within the heart. So there have been some reports of around a little bit over 1,000 patients that have had myocarditis following some of them following the first dose, but most of them following the second dose of the mRNA vaccine. Most of these are male patients, and they are young patients, the median age around 24 years old. So late adolescents, early young adults. And typically onset of symptoms is around 5 days following the vaccination. The most important thing, and this is what I want to make sure that I'm very clear about, these patients have recovered based on the data that we have so far. These patients have recovered very well, and without any major sequela. Of course, we still need to continue to monitor them, but based on the data that we have right now, all of these patients has recovered very well. Um, so the important thing is, first, it's still very rare. It's something that we've been seeing as following the vaccination very rarely. And the question is there still benefit in obtaining the vaccine, knowing that this risk could be present? And the answer is yes, based on the mortality rates, the infection rates that we've been seeing uh, during the pandemic. um, Having the vaccination, getting the vaccination is the only way to prevent thousands of cases and thousands of infections, but even more important, to prevent many hospitalizations to the intensive care unit and to prevent deaths. So when the experts looked at the incidence, which it ended up being around 12 cases of the myocarditis per a million doses of the vaccine, so still very few and very rare side effect. So when the experts looked at that, but then they looked at the infection rates, at the mortality rates, that's when they decided the benefit definitely still outweighs that risk. And the recommendation is for our young adults to receive the coronavirus vaccine. Otherwise, as I said, we're going to be looking at many hospital stays and deaths as well. So that's the important point that I want to make sure that I transmit to everyone. Number one, these patients have recovered very well. Most of them have been discharged from the hospital based on the report that and the data that was available, and they are doing very well. And based on the benefits of this vaccine, it's going to help us prevent many deaths and hospital admissions. So that's why it is recommended.
Thank you. Thank you both. Sort of switching gears a little bit here. Does being vaccinated prevent transmission of the virus? Can you speak to that question?
So based on the evidence that so far we have available, it's still a possibility that you could transmit it, but the risk is decreased definitely with the vaccine. So definitely decrease chance of transmission after vaccinated. It's decreased for sure.
I agree. It's very, very low. It's very, very low, and we're seeing it especially in large hospitals where 60-70% of the workers have been vaccinated. The risk of transmission is very, very low.
Thank you. So more and more we are hearing as we move into a later phase, as it were, in vaccination, we're hearing more and more about boosters. Can you say anything? I know it might not be an option to say anything definitive about this right now, but can you talk a little bit about whether or not there may be a need for boosters after being vaccinated? We're also hearing about um, folks that have had the Johnson and Johnson vaccine possibly needing Pfizer or Moderna as a booster. I realize I'm kind of adding a new question on top of one, but boosters, that is a word we're hearing a lot lately. Can you talk a little bit about it?
So before we go to the specifics, the good thing is both Dr. Zayas and I practice medicine in a group that vaccinates people always. And I just want to lay a background. The idea of boosters is not new. So I'll use a common example, the Tdap, the tetanus, diphtheria, pertussis vaccine. A lot of people go to the ER after a car accident, they get a DTaP or Tdap, even without knowing sometimes, because they need a booster. In our pregnant cohort, we give the Tdap, which has the tetanus vaccine, and the whooping cough vaccine with every pregnancy because studies have shown that the immunity would develop to some vaccines will wear off or wane over time. And the goal of getting a vaccine is to protect us. So if we think that the immunity is decreasing, then we want a booster to bring it up, as the word says. Or if we think there's another strain that was not covered originally, then we need a booster to help our immune system. Because everything is preventive, we're trying to help our immune system. So the idea of a booster in vaccines is generally known and established, and why we do them is known. As far as the COVID-19 vaccines are concerned, one of the things I want to say again is when something is novel and it's taking a lot of lives of people we love, we always want to be proactive. If we're going to need boosters, how we're going to need it, as evidence comes forth, we will continue to discuss it. But I want us to always remember that the idea of a booster vaccine is not new. And many times you get it when you need a tetanus booster. You might not just remember, it's to help your immune system to stay on top of its game because you want it to keep preventing the infection. Dr. Zayas.
Yeah, no, absolutely. I agree. Uh, Based on what we've heard from the experts, in terms of from a public health perspective, there will likely be a need for the booster, and that decision in terms of when it's going to be informed by multiple factors. And Dr. Goji addressed some of those. First, how long does the immunity provided from these vaccines last? We are still learning about that. The other thing is the effectiveness from these vaccines against the different variants that we've seen. As the virus mutates, some variants might spread more easily and might persist. Some variants may go away. But as we're studying those variants and the effectiveness of the vaccines against those variants, that also will help us will inform us on making that final decision about when the booster might be needed. And the third point is also related to the immunocompromise, or people with weakened immune systems. How is that protection from the vaccines? How long does it last? How well protected are they? So we are looking at all those areas, and the experts are looking at all of that, looking at the data, and once we have that evidence available, the recommendation regarding the timing of the booster participating then will be made available to the public.
Thank you both. I'm sure that's a topic we'll be continuing to hear more about moving forward. So we are having some more questions come through in the Q&A box, and I would like to read them aloud so that we can answer them live. And we'll also be offering some answers as well through text from some of our folks who are supporting this webinar tonight. So on the topic, we were talking a little bit before about, or referencing, herd immunity. So one question is, why is natural immunity, as determined by antibody testing, not included in herd immunity?
Could you repeat the question? Wasn't it's
Why
not
is
clear.
natural immunity, as determined by antibody testing, not included in herd immunity, or not considered herd immunity, part of the herd immunity?
Can you hear me?
Yes.
So the question is, if I understand correctly, why is natural immunity or antibody immunity not natural immunity not associated with herd immunity?
Yes.
Well, in terms of the natural, so there's two ways to get immunity, right? Either you get an infection, and then your body is able to recognize um, that foreign antigen, and then you are protected, or through vaccines. And in terms of herd immunity, we don't necessarily rely on people getting a disease in order to build what we call the herd immunity. Ideally, if there's ways to prevent from people from getting a deadly disease, we want to make sure that we are proactive in ensuring that we reach that immunity through the vaccines, rather than waiting for people to get through immunity via getting a disease that could be deadly. To answer the question, as soon as there's an opportunity to receive immunity via vaccine, then ideally, when we're talking about risk of death, ideally we can get towards herd immunity by providing massive vaccination. That's the other thing. We still don't know what's going to be herd immunity for this particular virus. It was, probably we are talking about over 80% of the population vaccinated in order to achieve that.
Thank you so much, Dr. Zayas. Just to piggyback on what he said, not everybody develops the same level of immune response to any vaccine. And unless we're drawing blood from everybody, we can't say with certainty that we know the immune response of everybody to an infection, which is what I think the question is all about. So for example, there are studies out there that shows generally when they look at the immune response after the infection, not everybody develops the same robust immune response, one. Two, there is a study in the women's health world, especially obstetrics, where they actually looked at pregnant patients that had immunity from an infection, and they compared it to women that developed immunity from a vaccine. And from that study, they realized that the women who developed immunity from the vaccine had a more robust immunologic response than women who had the infection. That's number one. And even when they looked at the women who had the vaccine, how much immunologic response or the robustness of the immunity also varied depending when the woman got the vaccine. So in that little study, I always call them little because compared to the entire world, it's still a small sample. The women who got 2 doses mounted a better response than women who just got 1. Women who got a vaccine just before their blood was drawn did not have a robust response like those who had received it at least a few weeks prior. And those are the things that make the decisions about when do you think you're fully immunized and all that. So these are like research of 300 women. So they have small samples, but they show that we don't all mount the same antibody response the same way. So you don't want to depend on that for your family, for yourself, especially with a novel disease that is a pandemic.
Thank you. Yeah, thank you, Dr. Goji and Dr. Zayas. I think that you were dovetailing nicely with what was also offered by one of our support people as a text response, just so everyone can see that as well. Natural immunity may help with herd immunity. The reason the vaccine is recommended is that protection appears to be better and may cover some of the new variants that natural infection may not give. So just like what you were saying, Dr. Goji, the strength of the immunologic response. Thank you for answering that question. Another question we have here is not actually about the vaccine, but it's about COVID itself. Hopefully you feel comfortable answering a question about that as well. And that is, can you speak a little bit about the effects on the brain of having COVID, or the neurological effects of having COVID? What have we come to awareness about neurologically and for the brain when having COVID, from having COVID?
Yeah, so we could divide that by acutely, meaning let's say you get COVID and you are actively sick and infected with COVID, and then we've been seeing also patients having long-term impact in their health, including neurological health following COVID. Acutely, of course, there could be headaches, there could be inflammation within the brain, there could be strokes as well. So those are some of the serious conditions that we could see if you have COVID and you develop that acutely and you are acutely infected with it. Long term, there could be problems with concentration, with memory, with sleep, and that's what has been described as the kind of post-COVID syndrome. That even months
Right.
following an acute infection, um, they could still have these problems with sleep, with memory, with concentration, and affecting, of course, their activities of daily living as well.
Right, that COVID brain fog that we hear about seems to be what you're talking about. Dr. Goji, any thoughts on that question?
I totally agree with him. And I like the way he divided it into the acute and the long haulers, as they all call it now. So,
right, long haul COVID. Another question from the Q&A. Should we expect to see another surge of COVID cases when the weather gets cold again?
So what I would say about that is if if it depends. It depends on our vaccination efforts. If we get the vaccine, the models and everyone gets vaccinated and we all do our part, the models indicate that we might not see that surge and that we might control the spread of the virus, and also start thinking about ending the pandemic. However, if we do not see the vaccine rates to go up and see these massive efforts in terms of of vaccination pay out and see an increase in the rate of the vaccination, we might see, based on the models that have been shared by the public health experts, we might see another surge.
Which is why it's so important that we're having these conversations
Yeah,
months into our
Right.
vaccination campaign.
yeah. I just want to say he just said it so excellently. It depends on us. We need, unfortunately, the burden is on our shoulders, but we need to keep the work going. You know, as Dr. Zayas was responding, what came to my mind is data that came out that there was decrease in patients going to the hospital and ER for flu-like symptoms and emergencies and admissions and hospitalization. And I think it has to do with all the respiratory hygiene, all the preventive um, measures we put in place for COVID. It was also helping and preventing a lot of hospitalizations and ER visits for the flu. So it shows that when we all play our parts, we do all the right things to prevent viral or respiratory infection, then we win. So I'm hoping we can all try and keep going, playing our parts.
Absolutely. Here is a great question that is something I wanted to ask anyway, and that is, the question is, can I get the vaccine at my doctor's office during a regular checkup or visit, or do I still need to schedule an appointment? So where are we at with what are people's options for getting the vaccine as of today?
Oh, there are tons and tons of options today. It depends on who your primary care is, but there are tons of options. You can go to any of the pharmacies. You can go to a walk-in. Right now, the Cleveland Clinic has a big campaign at the Lutheran Hospital area. You can go there. I mean, all our hospitals in Northeast Ohio, many of them have walk-in options. Some of the doctor's office have it, the pharmacies have it. Ohio Department of Health also is campaigning. Some places have even mobile stand. So there are tons of options. And if that person needs some resources, please let us know, because there's so many options that you can walk in and get your vaccine. And even if you got the first dose in a particular place, you can go somewhere else to get the second dose.
Absolutely. I just want to add, yes, call your doctor right away. We are expecting more practices and more offices, and to start being able to administer the vaccine in those sites. However, let's say your doctor is not able to administer in their practice, go to your nearest pharmacy or your nearest grocery store, and you'll be able to get it there. The other thing, I completely agree with, of course, going through your doctor, going through pharmacies. In terms of the state of Ohio, absolutely. Uh, Very easy through their different phone numbers, but also there is a website where you can type your address and it will show you the closest location to you. And it's called gettheshot.coronavirus.ohio.gov. Gettheshot.coronavirus.ohio.gov, and you can see the closest location to your house where you can get the vaccine.
Good stuff. One more question in the Q&A. This is an excellent question. Might be a little tough, so don't hold your breath. What can I tell family and friends who don't want the vaccine to persuade them to get it?
Excellent. It protects them. It protects their loved ones. It protects their community. it protects their way of life, and it allows them to resume normal things that they've always wanted to do. We see the vaccine in a little way to prevent an infection. That's true. But everyone wants to get back to their normal way of life. Think about the grandmother in the nursing home. She wants to see her grandchildren. Think about people of faith that want to go back to their faith centers. Think about people who want to play basketball together, people who want to have, summer together, camps together. It's about what they love. It protects them and allows them to get back to normalcy, which is good for mental health. Getting back to the normal things you've always wanted to do without having that fear that you might be exposing or endangering yourself. So look at it in a more holistic way when you talk to them.
Dr. Zayas?
Yeah, no, absolutely. This is our chance to make a difference, uh, not in our life, but in our life of our community and in the life of our family. This is our chance. A lot of us, we wait for opportunities to make a difference
Mhm,
in the life of the people we love.
mhm,
This is a great Father's Day gift, Mother's Day gift. This is a great uh, Christmas gift or holiday gift with the winter coming within the next 6 months. So this is the time we can make a difference for our family, for our friends, and get back to enjoying. Absolutely, get back to enjoying the things that we enjoy to do. And
mhm.
and there's a way to get there. So that's the most important thing. And there's a safe and effective way of getting there. So yeah, so that's what I would recommend.
And I agree, Dr. Zayas. In fact, I'll steal that word. That is the way to get there.
Right,
That is the way to get there.
right. Absolutely, absolutely. Otherwise, with with the surges, then we get back to seeing the cases in the hospital. We all remember when the EDs were packed,
Mhm,
emergency rooms. The emergency rooms were packed of people. There were no ventilators. Remember, there were
mhm.
no ventilators. The intensive care units were full of people. People were dying. There is a chance that could happen again if they're spread in the community, active spread in the community again. We're still studying and looking at the variants. We're still looking at the length of the immunity. So there's still a lot of factors that we are getting information and studying and looking at. So it's not worth taking that risk of going back to April to May, June of last year, or even last winter. Just thinking about it should be enough to motivate you to get that vaccine.
Dr. Zayas is on a roll. I love some words. He says the EDs are packed. And one of the things that comes to my mind is you may think your immunity is good, but if the EDs are packed full and the hospital is packed full, what happens is they divert the attention that you need to the ED that is full of COVID patients. There were studies out there that showed that people were not going for their routine care. People were afraid to come into the hospital. So it has a very big effect. It's not just for the person who gets the COVID, but for you who does not have COVID, but you're unable to go to the hospital because all the resources is going to COVID. For
Right.
you who's not able to go for your routine care, your mental checks, because there is no vehicle or the hospital has diverted all the resources. Also, it could lead to shortage of medication. There was a time there was shortage of azithromycin, shortage of, in some regions, of testing kits because they had diverted the testing platforms to COVID. So it's a big, it's all about our communities and 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 our country and everything. So there is a lot of benefit if we can not go back to the former time of a high rate of COVID infection. Thank you for that question. That is a very good question. it got me really thinking. Thank you.
Absolutely. We've had some great questions, really on the ball about where we're at, and some great responses from our docs. So we have exhausted the Q&A box at this point, and we've got about 9 minutes until 8 o'clock. So I'd like to invite both of you, Dr. Goji and Dr. Zayas, if you have any final thoughts, final remarks. Is there anything that wasn't asked that you feel this audience should know before we close? Now is the time. Floor is yours.
Thank you. I mean, I think we've answered a lot of questions. This has been a wonderful discussion. My parting words is what I tell a lot of my patients. It's okay to ask your questions. Just make sure that all your questions or concerns are answered, and please get the vaccine. It's okay to be hesitant. It's okay to do your research, but make sure all of them are answered. And once it's answered, please get the vaccine. As Dr. Zaya said, it's the way right now to get a hold of this and get back to normalcy. Thank you for having me.
No, yeah, absolutely. I completely agree. This is this is exactly what everyone, and this is exactly what I did, and what everyone should be doing, asking these questions. What about the safety? What about the effectiveness? Is it safe? Does it work? What about the side effects? What to expect? I just wanna mention, because there could be questions about what to expect. What about this? What about fever or a headache? Yes, we know about those side effects. They can happen after the vaccination, and we know about them. We expect them, but not only after this vaccination, we see them also frequently after multiple of the other vaccinations that we have available. And those could be a headache, that could be fatigue, that could be joint pain, that could be muscle aches, that could be a fever. Most commonly, where it was injected, you might see a little bit of redness, some swelling, pain in that area. Yes, we know about those side effects. We expect those side effects, um, but those side effects are better than being in the hospital with the coronavirus infection, and the risk of having, failure in terms of your lungs stop working. So we know about this, and we can manage those. Everyone
Mhm,
can get a little bit of Tylenol or Motrin after their vaccine,
mhm,
and that was my experience, at least following the vaccine. If there was any soreness, with a dose of Tylenol, I did very well afterwards. So same thing. It is available. It is safe. It is effective. It is available in the community. So now is the time to get it. So thank you for this opportunity.
Thank you, Dr. Goji and Dr. Zayas, for your generosity with your time. Thank you to the Cleveland Clinic for partnering with NAMI Greater Cleveland on this program. My hope, our hope, is that the information shared today from these trusted voices, these leaders in our community, will help you to make a decision about taking the vaccine when and where it is available near you, and maybe stimulate some conversations with your families. This vaccine will greatly reduce the risk of severe illness and death to yourself and your loved ones. This is a time of great uncertainty, but NAMI Greater Cleveland and Cleveland Clinic, our shared goal is always to equip you with the right tools and accurate information to support your wellness. We are pleased to work hand in hand with you to help one another get through this pandemic. There's information on the screen right now about the vaccine from the Cleveland Clinic's website. You can call the number on the screen for an appointment. Again, this webinar was being recorded and will be posted to the Cleveland Clinic's YouTube and social media, and also NAMI Greater Cleveland's YouTube. So thank you so much for your attention to this important topic. Thank you for your time tonight, and hope you have a wonderful evening, and please stay well. Thank you.